Everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Gouri Pimputkar. Hi, Dr. Gouri. How are you?
Hi, how are you?
I'm doing great. I'm so excited that you're part of this book and this project. Can you tell us a little bit about yourself?
Sure. Well, first I have to say thank you. Thank you so much for doing this project, inspiring all of us to be part of it. And I am so thrilled to be part of this collaboration. So I am a board certified OBGYN as well as in lifestyle medicine. And I currently live in the state of Florida, and I've been in clinical practice for about 18 years and recently have left the traditional model of practice to pursue my passion as well as how I incorporate lifestyle medicine into how I practice.
That's amazing. I so want to learn all about what you're doing. So take us back a few years. How did you first get introduced to lifestyle medicine?
So I think I was always practicing lifestyle medicine with my patients for years. I believed in this. I always talked about the pillars of lifestyle medicine without even knowing that there was a field of medicine that existed with this name. And I really struggled when I would see patients in the clinical setting because I wanted to spend more time with them. I wanted to, go home with them and help them make better food choices or help them with improving their stress and improving their just overall state of being, not realizing that that wasn't necessarily the right forum for me to do so, because in traditional clinical practice, we have 10 to 15 minutes to see a patient. And as most women, as a gynecologist, we save a whole year's worth of problems when we come to the doctor and expect everything to be taken care of in one, fall swoop. So that being said, I was always practicing that way. And I didn't realize that I was struggling and suffering in the process. So it was definitely a case of, I just, I lost myself along the way because I was trying to keep up with practicing and working and being a full-time physician and being a full-time mom and trying to do everything. And so in the middle of all of this, coupled with a pandemic that happened as well, I realized that I was on that hamster wheel that was leading toward burnout, as many physicians I'm sure that you've interviewed as well can attest to. And I was sacrificing my sleep. I was sacrificing not my diet so much, simply because I'd always I ate a certain way. I tried to eat on a healthier plan, but I definitely was compensating for my stress and lack of sleep by, stress eating and buffering and doing all the things that we did or we do because I didn't know how to handle or process the emotions that were going behind the stress. So I had these like little glimpses of wake up calls. So there wasn't one defining moment that said, okay, like you have to make a change for yourself personally so that I could show up better for my patients, so I could show up better for my family, and really show up better for myself. I didn't even think of putting myself first in any of this. And along the ways, I started developing some chronic illnesses. Some of it comes with age, but some of it was probably induced with the life that I was, kind of literally speeding ahead toward. So I happened upon lifestyle medicine, or the concepts of like truly defined lifestyle medicine, I listened to a few podcasts, I read a few books, I met another OBGYN colleague who was also interested in the same things. We, went to a conference, and suddenly I was like, I found my people. Like, where has everyone been hiding all this time? And truly believe that I didn't even know that this existed in this capacity. So that being said, once I discovered this secret, I felt like I couldn't go back to practicing medicine in the same capacity. I just wanted to do more. I wanted to share with my patients. I wanted to go through the struggles that I have personally gone through, my health challenges of PCOS and infertility and borderline diabetes. Like, I was doing all the things that I was trying to tell my patients that they had to be better about. And I suddenly started making small changes that were, there wasn't a one size fits all diet. There wasn't a one size fits all treatment plan that would help, but I was noticing dramatic improvements in my own health and in my own way that I was showing up. And I started incorporating that into my clinical practice, realizing that that wasn't necessarily the forum to do that in anymore. So I left traditional practice, and now I am currently working with this amazing collaborative healthcare digital platform where it's a women's health company that takes care of women who are suffering from all chronic hormonal conditions. So ranging from PCOS, infertility, insulin resistance, borderline diabetes, thyroid problems, menopause, premenopause, you name it. If you are a female, we've all experienced some degree of this. And this platform allows healthcare providers to really make meaningful change for our patients. And we get to talk about lifestyle principles. We get to practice evidence-based traditional medicine. And then we collaborate with a team of nutritional experts and dietitians to really meet the patient where they are and what is sustainable for them and what they can accomplish for their goals that they set forward. And it's a combination of practicing medicine and health coaching. And I am truly living my best life finally.
Wow, you gave such an amazing answer. I wrote down so many notes, but you already answered my next question, but I'm going to go back to some of the things that I wrote down about what you said. My next question was, how are you incorporating lifestyle medicine into your clinical practice today? And I think you answered that. Quickly on that, really quick, what is the name of the platform and how can people find you there? Because I think what you're doing is so much needed.
Absolutely. So the name of the platform is called Alara Health. And you can find me there at that website, or alarahealth.com, or you can also find me on Instagram at Wellness with Dr. Gouri. I am in the process of launching a separate health coaching platform just so I can do more of what I like to do and work with patients a little bit more personally and really meet the needs of patients in a different capacity, in like a health coaching capacity, as well as working with them through Alara.
Thank you for that. I hope people reach out to you. So I'm going to go back to some of the things that you said that I thought were impactful. You highlighted how women save up all the problems for a 15-minute visit. I think we do that. Men are probably worse. They don't even make that 15-minute appointment per year, but we do need more support throughout the year. And then you highlighted, as time went on, you had insight into your own contributing factors to burnout. And I think that's what led a lot of us to this lifestyle medicine journey. And I commend you for following it and following, the path, which has led all of us here to get board certified and then use it for your patients. What else did I write down? And then you wrote down about the emotions behind our lifestyle choices. I'd like for you to expand a little bit more about that, because I think a lot of more, but a lot of what we do is fueled by our emotions. And anyway, just expand on that a little bit if you have.
Absolutely. So, I can speak from my personal example. So, for many of the physicians, I'm sure that are authors in the book, as well as my colleagues that I've interacted with over the years, we literally get on that treadmill and we go. We were told if we work very hard at something, we will accomplish it. And with, trying to get into medical school, residency, practice, and then there's the added layers and the dynamics of being a female in medicine, and depending on where you are practicing, academic centers, private practice, there are variations of struggles that we all have to endure. And what I noticed as time went on is that I started wearing all of these, if you want to call them micro traumas or struggles or whatever you want to call it, I started wearing it like badges of, look at what I can do. I can not sleep for 3 or 4 days in a row and still go and be super mom and show up for field trips and do all these things. And it was literally eating me away, but I didn't see it until I I had some circumstances that led me, it was in my face, and I realized I had to make a change. But what was happening was I didn't know how to cope or process with the emotions or the physical state of fatigue, or, I, with the line of work that I do, I see majority great, happy moments of life, but I also see some very awful parts of practice. And no one had ever helped me learn how to process that and understand it. So instead, I would work harder, or I would, stress eat, or I would over exercise, or I would just over everything, not understanding that it was coming from a place of, well, hold on a minute, like, you need to understand why this is happening, and it's okay. It's okay to experience this. It's okay to feel this. It's okay to not be great for one moment in time. And that was this big awakening for me. And now I'm at this place, and I really believe that lifestyle medicine was such an contributing force for this, where it just made me pause. And now if I move for exercise, I'm doing it because I enjoy it. I'm playing with my children, I'm riding my bike, I'm not grinding away at the Peloton or whatever gym equipment it is because I feel like I have to exercise for a certain number of minutes to maintain my fitness level. I'm doing things with intention, and that was a big eye-opening experience for me. So with that being said, I love to talk about this with patients. And patients, when you probe a little bit further, it's almost like you can always find that emotional reason for why they are doing the things that they're doing. And it gives us power when you understand where it's coming from, as opposed to, as a gynecologist, everyone loves to blame their hormones as the root cause of every problem out there. And some of it is really true, right? But some of it is not. And so I love to just share a little bit of that, like, hey, maybe we got to dig a little deeper. And now I have the opportunity to spend time with people, patients, anyone that'll listen to me, and talk about that.
I love that. I love your insight into yourself, and I love how you're helping patients find insight into themselves, and the statement about, yes, everything is about your hormones. I hear that too sometimes. In the eye world for dry eyes, it's always menopause or hormone replacement therapy. Anyway, without getting into dry eyes. Okay, well, let's switch gears a little bit to the book, How Healers Heal, which I'm so excited about people reading your chapter. I don't want them to don't want to give away anything else, but why should doctors or non-doctors, patients read this book?
I love this book for so many reasons. I think it is raw, and it's real, and it's powerful because it obviously lets the world know that there are so many amazing physicians out there that are, constantly learning, constantly trying to do better and more, and really make meaningful change. So I love the message that is inherently behind each chapter. And I also love that it makes us human. It makes us real, like, for the non medical reader, you realize, like, we go through the same challenges as everybody else. So for that, I love that it gives anyone who's reading this book, it gives you the power to believe that change is possible. And that's why I like this.
The power to believe. Lifestyle medicine is the power to believe. I love that. I have to write that down. Okay. Next, what is your number one tip for self-care or takeaway for lifestyle changes while people are waiting for their copy of the book in the mail?
So my constant struggle for adapting all the principles of lifestyle medicine is managing stress and self-care, of course. But I think my biggest piece of advice is we deep down inherently know what we really need. And I think if we can pause and just listen to what our body needs, I believe the truth lies there. And there's no one size fits all way to accomplish that. There's no, you like, if you subscribe to this diet, you are going to feel amazing. Or if you move in this direction, or if you, whatever the thing is, there's no recipe that will fit everybody. So that I think is the biggest takeaway point for me is just we know what we need. We just actively choose to not listen to it all the time.
You are so right. Oh my gosh, this interview has just been full of wisdom and pearls, just listening to our own bodies. Thank you so much for that. Oh my gosh. I don't even know what else to ask. Do you have anything else you want to share? Any nuggets, any pearls? And then, of course, please tell us how to connect with you again. And I hope patients
Uh,
reach out, read the book, read your chapter, and change their lives with the power to believe in themselves.
So I had one last thing to add. With everything in my career and my life, moving at full speed ahead as I have described, I think in the back of my head that I wanted to accomplish all of these goals because I wanted to be a positive role model for my children. I have two daughters and a son. And for my daughters, I wanted them to I wanted them to know, like, if they put their mind to it, they could accomplish anything and they could be, completely independent and reach for whatever dream they may have. And when I was struggling with some choices that I was making professionally with my career, as well as starting to really dig in deeper to lifestyle medicine, I remember I had a conversation with my oldest daughter and I said to her, I'm like, I've been doing all of this my entire adult life because I want to set an example for you. And my oldest daughter, who at the time probably was at the tender age of 12, who has the wisdom of somebody much older, said, but what does it say if you keep struggling in a place that doesn't serve you? And if you keep staying in a place that isn't helping you? And I paused and I thought, that's it. Like, what are we doing to ourselves if we keep doing behaviors that are not really helping us? We think they are, but they're really not helping us. And that is kind of the new motto that I'm living of, you know what, just because we're supposed to be a certain way, I think sometimes we need to course correct and change. And if we don't show up for ourselves the way that we need to, we're all going to have more health concerns, more health chronic problems. And this is a way to help us really tailor it to how we need it to be.
I have no words. Just wow. If we don't show up for ourselves, who are we going to show up for? And our kids, of course.
Mm-hmm. So thank you again for this opportunity. This has been such an amazing experience. You can find me at www.alarahealth.com, as well as on Instagram at Wellness with Dr. Gouri. And this has been tremendous.
Thank you so much, Dr. Gouri. Best wishes to you and your family, and we will talk to you soon.
That sounds great. Thank you.